Hey everybody, Dr. Nuveen here. On today's video, we're going to be talking about the different kinds of braces, the advantages, disadvantages, features and benefits of each kind. I'll see you in a sec. So here we have a set of teeth. We call this thing a typodont, set up with braces on it. Now, these braces are a unique kind of brace, and I'll get to that in a second. But I just wanted to explain that these braces have a special door built into each brace that allows us to put the wire in and out of the brace. You see that? It's a little hard to see. But when I put the wire in there and I close the door, the brace itself holds the wire in place. A more traditional type of brace is just a brace that has a regular little cutout in it. We call it a slot. And the wire that we use to straighten the teeth is held into the brace with little rubber ties, little rubber rings. Those rubber rings come in various colors, and so you won't see any rings on here right now. Let's go back to the original brace that we were talking about. So there's two kinds of braces. This brace has a special door, and we call it self-ligating. It's a fantastic technology that allows us to straighten teeth in tremendously faster times than we used to. And much more comfortable for the patient because the wire sort of slides around in the brace. There's very little friction. We don't have to use a lot of force to push on the teeth to straighten them. So therefore, lower forces, more comfortable for the patient. Also, we can stretch the appointments out for a longer period of time between adjustment visits. So most of our adjustment visits are somewhere between 6 and 10 weeks apart, and in some cases, even as far as 12 weeks apart. So those are the sort of regular braces that we use. We also have clear braces, of course, that we can use on the upper front teeth. We don't use them on the bottom teeth because often when patients start out in their treatment and their teeth aren't straight, their upper teeth overlap the bottom teeth, and if upper teeth bump a bottom clear brace, it will wear a notch in the tooth. So basically the upper clear braces are restricted to the upper front teeth, and then the lower teeth would get a different kind of metal brace. The clear braces they look great. They are very difficult for me to use. I don't have the control of the positions of the teeth that I do with silver braces, and they're very fragile. So when we're using certain wires to straighten the teeth, it's not uncommon for one of the brace or part of the brace to break off, and then we have to replace the brace. And also at the end of the treatment, they're very difficult to get off. So I'm not a huge fan of the clear, but for patients who insist, we have that option available. Also, ta-da, I showed you this earlier. Now, you may have noticed that these braces are not silver. They're actually what we call a champagne color. And they're super popular, mostly female patients. We don't have any men that are using these braces yet. But I think they're a great alternative to the sort of silver gray tone that the regular braces provide. Now, these braces are the more traditional style with the little cutout and have the little rubber rings. Now, the rubber rings hold the wire in place and help move the tooth, but they also add a lot of friction. When there's friction, we have to overcome the friction to put force on the tooth, and therefore we have to use higher forces with this type of brace. It's not crazy, it's just we have to push the teeth a little harder to get them to move, and some patients complain that the teeth are sore. Of course, patients with the traditional silver braces that we use also complain that their teeth are sore. So I think that's it. Basically, we have clear, we have champagne color, and we have silver braces available for our patients. Thanks for listening, and I'll see you in the next video.